Vitamin E functions as an antioxidant in the body. Specifically, vitamin E is incorporated into low-density lipoprotein or LDL particles, and it protects them against oxidative damage. It seems to guard against atherosclerosis by other mechanisms. The gamma-tocopherol form of vitamin E appears to complement the anti-inflammatory action of alpha-tocopherol. Gamma-tocopherol has been shown to inhibit the COX-2 and attenuate interleukin-1b signaling. In a small clinical trial on subjects with metabolic syndrome, the combination of gamma-tocopherol and alpha-tocopherol effectively suppressed C-reactive protein and TNF-alpha levels compared to a placebo. In this study, the combination of both tocopherols performed better than either alone, prompting the investigators to remark, the combination of alpha-tocopherol and gamma-tocopherol appears to be superior to either supplement on the biomarkers of oxidative stress and inflammation. Zinc and selenium containing antioxidant proteins such as superoxide dismutase and glutathione peroxidase reduce reactive oxygen species or free radicals, and this indirectly inhibits NF-kappa B activity, and it prevents the production of several inflammatory enzymes and cytokines. Zinc can also inhibit the NF-kappa B in a more direct manner. Zinc supplementation is associated with decreases in inflammation in populations that are prone to zinc deficiency, such as children and the elderly. Low levels of inflammatory and circulating pro-inflammatory factors like C-reactive protein, TNF-alpha, interleukin-6 and 8 were reduced in elderly subjects by moderate zinc supplementation in several studies. Like zinc, selenium deficiency is common in chronic inflammatory states associated with diseases such as sepsis, where selenium supplementation has been associated with reductions in inflammation and better patient outcomes. Specialized pro-resolving mediators, or SPMs, are cell signaling molecules, and are derived from the metabolism of polyunsaturated fatty acids. They play an important role in the resolution of the inflammatory response. The SPMs include lipoxins, resolvins, protectins, and myrcins, and their precursors. They don't merely inhibit inflammation, but they actively resolve the inflammatory process, and they help to return the tissues to a normal state. The SPMs recruit macrophages to clear the cellular debris, and this allows for the recovery of the healthy cells, rejuvenate tissue damage by inflammation, and restore the balance between anti-inflammatory cytokines and pro-inflammatory cytokines. Chronic inflammation contributes to the aging and degeneration, and pro-resolving mediators might help to reduce the risk of some of the diseases associated with the inflammation and the aging. Research on obese mice suggests low-grade inflammation drives metabolic disturbances, and the SPM precursors might mitigate the obesity complications. Another study demonstrated that 1 to 5 milligrams per kg per day of the SPM resolvin E1 reduced atherosclerotic lesions in mice who were fed a high cholesterol diet for 9 weeks. SPMs derived from marine oils help to support the body's efficient resolution of the inflammatory response. The body creates pro-resolving mediators from omega-3 fatty acids, including EPA and DHA. However, they're not completely converted into SPMs. Omega-3s and SPMs also have distinct roles in the body. A novel clinical trial was conducted to better understand the effects of the supplementation with EPA and DHA on the SPM plasma concentrations of lipid metabolites. A total of 21 patients with chronic inflammation were randomized to sequentially receive 3 grams per day of EPA or DHA for 10 weeks. There was a 10-week washout period in between. The study also included an ex vivo analysis, which evaluated how the SPMs derived from the EPA and DHA differed in their effect on the inflammatory cells. The results showed both the EPA and the DHA increased plasma levels of SPMs and SPM precursors in their own manner. In the ex vivo portion of the study, the monocytes, or the macrophage precursor cells, derived from the participants' blood samples were stimulated in vitro with a toxin, a lipopolysaccharide, to induce an inflammatory response. The genetic expression of the pro-inflammatory TNF-alpha and monocyte chemoattractant protein 1, or MCP1, were decreased by both the EPA and the DHA in vitro. EPA had no effect on the pro-inflammatory interleukin-6 expression, however the DHA decreased it. DHA lowered the anti-inflammatory interleukin-10 expression, however the EPA increased it. Interestingly, DHA inhibited individual pro-inflammatory cytokines more potently than EPA, but EPA more efficiently balanced the ratio of the inflammatory cytokines to the anti-inflammatory cytokine interleukin-10. These results provide new insights into the independent effects of EPA and DHA and suggest both omega-3s play important roles in inflammation resolution. The exact mechanism by which the resveratrol exerts anti-inflammatory activity has not been established, although it inhibits a variety of pro-inflammatory compounds like cyclooxygenase, TNF-alpha, interleukin-1-beta, interleukin-6, and NF-kappa B in animal models and human cell culture. The related compound pterostilbene has demonstrated a similar inhibition of inflammatory markers in cell culture. Modulation of the inflammatory immune response likely contributes to resveratrol's protective role in animal models of heart disease, cancer, acute pancreatitis, and inflammatory bowel disease. Resveratrol might be protective against general low-level parainflammation when it's taken with a single high-fat, high-carbohydrate meal. Resveratrol at 100 mg prevented the sharp post-meal increase in the markers of oxidation and inflammation in a small crossover study on 10 healthy volunteers. For example, the synthesis of interleukin-1-beta increases by 91% over 5 hours following a test meal, but with the resveratrol, this increase was significantly less at 29%. Extensive in vitro and animal studies have examined the effects of curcumin on experimentally induced inflammatory diseases like atherosclerosis, arthritis, diabetes, liver disease, gastrointestinal disorder, and cancer, and disease markers like lipooxygenase, cyclooxygenase, TNF-alpha, interleukin-1-beta, NF-kappa B, and others. Fewer human studies have examined curcumin's effect on patient-oriented outcomes in inflammatory diseases, but most of the small randomized control trials of curcumin have consistently shown patient improvements in several inflammatory diseases, including psoriasis, irritable bowel syndrome, rheumatoid arthritis, and inflammatory eye disease. The anti-inflammatory effects of green tea and black tea polyphenols have been substantiated by dozens of in vitro and animal studies. The polyphenols EGCG and theaflavin exert their anti-inflammatory effect through the inhibition of the NF-kappa B signaling pathway, and this decreases the expression of several inflammatory proteins. In cell culture experiments, the EGCG also inhibited the production and the release of histamine, a key mediator of allergic and inflammatory responses. In observational studies of tea consumption, more than 2 cups of tea per day, black or green, was associated with a nearly 20% reduction in C-reactive protein compared to non-tea drinkers, and significantly lower levels of 2 other inflammatory markers, serum amyloid A and haptogen, which are elevated in coronary heart disease. In clinical interventions, black tea appears to be more successful in reducing inflammatory markers than green. A 25% reduction in C-reactive protein was also observed in a small trial of healthy, non-smoking men who were consuming a black tea extract equivalent to 4 cups of tea per day for 6 weeks. A similar average reduction was observed in a large study on healthy individuals with a high risk of coronary heart disease, but it revealed a more dramatic 40 to 50% reduction in C-reactive protein among the individuals with the highest starting C-reactive protein values. In the Women's Health and Aging study, participants with the highest blood levels of alpha-carotene and total carotenoids were significantly more likely to have lower interleukin-6 levels than the participants with the low carotenoid levels at the onset of the study. The participants with the lowest blood levels of alpha and beta-carotene, lutein, zeaxanthin, or other carotenoids were more likely to experience an increase in interleukin-6 over a period of 2 years. Low levels of sex hormones are associated with systemic increases in inflammatory markers. DHEA, or dihydroepiandrosterone, an adrenal steroid hormone, is a precursor to the sex steroids testosterone and estrogen. DHEA is abundant in youth, but it steadily declines with advancing age, and it might be partially responsible for age-related decreases in sex steroids. In cell culture and animal models, DHEA can suppress inflammatory cytokine activity, in some cases more effectively than either testosterone or estrogen. Chronic inflammation may itself reduce DHEA levels. DHEA supplementation in elderly volunteers at 50 mg a day for 2 years significantly decreased TNF-alpha and interleukin-6 levels, as well as lowering visceral fat mass and improving glucose tolerance, both associated with inflammation in a small study. Fish oil is the best source of omega-3 fatty acids EPA and DHA, and these can only be synthesized to a limited extent in humans. Omega-3 fatty acids have been well studied for their prevention of cardiovascular disease and mortality in tens of thousands of patients. The anti-inflammatory effect of omega-3s contribute to this activity. They've also proven successful at improving patient outcomes in scores of studies of other inflammatory diseases, particularly asthma, inflammatory bowel disease, and rheumatoid arthritis. The association between greater fish oil and omega-3 consumption and reduced systemic inflammation is substantiated by data from several large observational trials. In 855 healthy participants from the Health Professionals Follow-up Study, omega-3 fatty acid intake was associated with lower plasma levels of markers of TNF-alpha activity. Interestingly, a high intake of both omega-3 and omega-6 fatty acids, which are usually assumed to be pro-inflammatory, was associated with the lowest levels of inflammation. The Nurses' Health Study cohort of 727 women revealed lower concentrations of inflammatory markers, including C-reactive protein and interleukin-6, among those in the top 20% of omega-3 consumption, when compared to those who consumed the least. In the ATT-ICA study of over 3,000 Greek men and women without any evidence of cardiovascular disease, the participants who consumed over 300 grams of fish per week had an average 33% lower C-reactive protein, 33% lower interleukin-6, and 21% lower TNF-alpha than the participants who didn't consume fish. In a sample of 5,677 men and women without cardiovascular disease from the multi-ethnic study of atherosclerosis, long-chain omega-3 intake from fish or supplements was associated with reduced plasma concentrations of multiple inflammatory markers, including C-reactive protein, interleukin-6, and TNF-alpha receptor. For more on chronic inflammation, herbs, supplements, or natural treatment plans, check out my website.